Let's talk for a minute about medications that are covered under Medicare Part B. Yeah, some people will scratch their head and say, I've never heard of that. I know about Part D, the drug plan, but Part B medications, I don't know anything about that. Well, stick around, you might just learn something. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Now, if you have original Medicare, hopefully with a supplement plan, and you get into a situation where you're going to need infusion therapy. Typically, this comes in the form of chemotherapy, but there are other medications also that are administered intravenously in a clinical setting, doctor's office or a infusion center or something like that. So there's medications like that that will fall under Part B. And if you have original Medicare and a supplement plan, especially if you have the Plan G, then you're out of pocket for those Part B medical drug infusions will be pretty much your Part B calendar year deductible, which is a little over $200, because Medicare is going to pick up 80% of anything over that, and your G plan will pick up the other 20%. So you're looking at minimal out of pocket as compared to those PPO and HMO plans that don't have a premium. They're still going to be charging you some kind of copay every time you get some kind of therapy in a doctor's office or clinic. And those charges will add up, and a lot of times, it makes those zero premium plans look a little not quite as attractive. And the Part B drugs are not just limited to infusion therapy, through IV. Some people who have diabetes, insulin-dependent diabetes, and they qualify for an insulin pump, you can often get your insulin through Part B, which also is going to reduce your cost. I know that the cost of many of the insulins have come down to about $35 per fill in the last couple of years, but that still is not going to match up with if you can get your diabetic insulin through Part B, then you're going to save even more money. So that's just something to consider. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.